Dr. Baines has low back pain with pain that radiates into his legs. That's worse with walking and better with sitting, which is very typical of a disease called spinal stenosis. The surgery is very small. The patients go home the same day, and they often see relief in a week to 2 weeks after.
Dr. Berger is a master at relieving pain in the back.
So this is a patient with a very common condition called spinal stenosis. Basically what it is it's old age of the spine. The spine gets older, and as it gets older, it gets narrower. When it gets narrower, it pinches on nerves, and pinching on those nerves causes pain that goes down into the back, low back, into the butt, and sometimes even into the legs. Now that narrowing of the spine can again happen with three things. The discs in the spine, which are shock absorbers, can bulge out and push on the nerves. Bone can overgrow and narrow the spinal canal on the inside, or a ligament in there, a soft tissue on the back side of the spine, can grow what's called hypertrophy. When it does that, it takes up space inside the canal, and that pushes on those nerves as well. So what this procedure is a minimally invasive approach to relieve some of that pressure inside the spine by scooping out or taking out some of that soft tissue on the back side, that ligament that has hypertrophied or overgrown. When we take that out, we do that through just a couple of small stab incisions, so less than a ½ inch incisions, and usually 2, sometimes 4 of those incisions. And under x-ray guidance, we then pass an instrument down to that ligament, and we just scoop it out, and we take out small bits of it. As it turns out, you don't have to take out very much of that ligament in order to get some symptomatic improvement. This surgery went as smoothly as I would expect it for this patient. This patient had very severe spinal stenosis, some of the more severe that I really ever see. He's a patient with stenosis at 5 levels of the lumbar spine. Essentially every level of the low back had some narrowing. Typically we see 1 or 2 levels that are narrowed, and this patient had every level narrowed. Typically the procedure takes in a ½ hour to an hour time frame, and this one took about an hour and a half to an hour and 45 minutes. There's really no activity restrictions, no clear restrictions. Minimal sorts of things would be keeping the incisions dry, the small incisions dry, for 2 to 3 days, though folks can be back to work, for instance, by the next week. So for instance, today we happen to do the procedure on Friday. This patient still works full-time, and I'm hoping he'll be able to work again on a limited basis, early next week, and by the next week hopefully on back to a full-time basis. The results from the procedure, the pain relief isn't generally seen for a week to 2 weeks, and so to get that full relief, it might be a couple of weeks before he's really able to work full-time at his regular peak activity. The surgery is very small. The patients go home the same day. They need typical painkillers after it, such as Percocet or Vicodin, typical surgical painkillers, and they often see relief in a week to 2 weeks after.
He explained the procedure to me. It seemed very reasonable, so that I was eager to undertake it. My lifestyle has changed because I can stand and walk without too much pain and walk further. My recovery has been outstanding. It was without any hitch, no pain, no residual pain.
Recovery is in a couple of different phases. First of all, it's an outpatient procedure, so patients will spend 45 minutes to an hour in the anesthesia recovery area, after which time, assuming that they've recovered from anesthesia, they'll be able to stand up and walk out of the hospital. Dr. Baines recovered faster than the typical patient and noticed relief within a few days after, and was actually back at work in 4 days. So he's done quite well. The typical patients are a week to 2 weeks before they're really seeing relief.
Oh, I couldn't stand long. I couldn't walk. more than 20 yards, and I was prohibited from exercising.
Patients who have this again are those with low back and leg pain that essentially again is worse with walking or standing long periods. His diagnosis is lumbar spinal stenosis, and as a component of that spinal stenosis, which is a narrowing of the inside of the canal of the spine, he has overgrowth of a ligament on the back side of it. That ligament, when it overgrows, it narrows the inside diameter, the inside of the canal on the spine, and compresses nerve roots.
Dr. Berger is very knowledgeable. He seemed to know the anatomy very well, and I trusted him implicitly. There was no pain at all, either before or during or after the surgery. I do addiction medicine, and I see a lot of patients of mine that have back pain, and I refer them to Dr. Berger for relief of that back pain. And the mild procedure was, he told me that it would relieve some of the spinal stenosis. So I elected for him to do that. Being a doctor makes me more cautious about anybody doing things for me, and I select my physicians very carefully.
It's quite typical for patients to be concerned about newer procedures that are coming on the market and becoming available to them. In addition, many of our patients have already failed more traditional therapies, are concerned that additional procedures may not be effective for them. For patients who are specifically concerned about this particular procedure, it is definitely a step up from traditional spine injections, and it's a step down from traditional spine surgery that's been offered for this. Approximately 1,000 of these procedures have been performed across the United States at this point with no serious harmful outcomes. So at this point it does seem to be a safe procedure. In my experience, the patients have done quite well. Those who haven't gotten as much relief as we would expect haven't been harmed in any way. All patients have gone home the same day of the procedure. Most patients are getting relief within a week.
Experience the Pain Center of Arizona and get back into life. Call 1-888-PAIN-CENTER.
Do I have to say what you want me to say?
No, you say the honest truth.
I can do some activities that I couldn't do before, namely walk the dogs.